right, sir. Everything looks good down here. You have good play.
All right, thank you.
Turn left heading 160, vectors for South Range.
Okay, ground, Delta Green 7-1, guard.
On today's Fit for Duty from Nellis Air Force Base, home of the Thunderbirds, grab those weight plates and let's get ready for a full body workout. I'm Master Sergeant Mike Skaggs, and welcome to Fit for Duty Las Vegas. I've got my fitness team here from Nellis Air Force Base, and we're going to give you a great full body workout using our weight plates. You guys ready? Yeah. All right, you ready at home? Good. Now, what we have here is I've got a 35-pound plate, a 25-pound plate, and two 10-pound plates. So does the rest of the fitness team, and I want you to follow along at home and adjust the weight accordingly. I just want you to be able to finish this workout. The first thing we're going to do is grab the heaviest plate you can, and let's do some squats. So go ahead and grab the heaviest plate you can back here, guys. Let's hold it here. You can hold it across your chest like this. I want you to squat down. Now I'm going to check form. You guys follow along at home. Listen for my verbal cues. Don't quit. We have here very good form. Notice how she throws that butt back. Nice 90-degree angle on the knees. Quads are nice and engaged, and she's holding that weight right there, nice and steady. Also giving her arms a little bit of a workout. That's the way it should look at home if you're doing it. Keep it up. How are we doing back here, guys? Good, you're still smiling. Nobody's crying yet. So let's go. 10, 9, 8, 7, 6, 5, 4, 3, 2. Now take it down and hold it right here and just set. Go 5, 4, 3, 2, 1. Stand up, shake it off. How we doing so far? So good, guys. Quads are burning. I know they're burning at home, but we're not done yet. All right, I want you to get your lowest plates here. For us, it's going to be our 10-pound plates. And we're just going to do some lunges. So we're going to step back and step it forward, step it back, step it forward. Now, if you have a couple 25-pound plates for you strong guys at home, you can most certainly use those. We're using our 10 pounds. But again, adjust that weight accordingly so that you get the most benefit from your workout. And the most benefit is by using proper form. I'm going to check their form. You keep going. Listen for my verbal cues. Great form here. She's stepping back, engaging that quad, knees not going over the toe. Look at that head and neck, smiling too the whole time. That's the way it should look. Him too. That's the kind of look you got on your face. You're doing the right thing at home. Come on. 1. We're going to do 5 more. There's 2. 3. There's 4. 1 more. And 5. Good job. All right. Down. Shake it off. If you want to stretch real quick, you can. Keep that body upright. Grab the ankle. If you need to hold on to a wall, you can do that. Stretch that quad a little bit. It's not been contracted from doing all these exercises. How we doing, guys? Good? Let's keep going. All right. Let's move on. What we're going to do is we're going to turn to the side. We're going to get our 10-pound plates. If you want to get heavier, let's say a 25-pound plate, we're going to do a row. Single arm row. These plates got a nice grip on them. And we're just going to do a single arm row right into that back. You grab the plate that you can handle. I'm going to check their form again. You keep going at home. It's a very key exercise, and you see it done wrong a lot. What you want to do is you want to keep it right, nice and tight to your body. Square that back up. Right there. Roll it right in. You're going to feel it right here. That's your latissimus dorsi. Your rhomboids are getting some of it. Your trapezius. Good single arm row. Again, you use the heaviest weight you can. Go 5, 4, 3, 2, 1. Switch sides. All right, again, you keep it nice and tight to that side and row it right in. Remember what I said about that form? That elbow is nice and tight to the body, and you're just bringing it in. Let's go 8, 7, 6, 5, 4, 3, 2, 1. Shake it off. All right, let's move on to our chest now. I want you to get the heaviest plate that you can possibly get. I want you to get on your mat. You don't have to have a mat. We're on a hard floor here, so we're using a mat. I want you to lay back. That plate goes right across the chest. You just press it up. This is a 35-pound plate I'm using. Get a 45-pound plate. If you're big enough, get that 100-pound plate. You don't have to have a whole rack of dumbbells to get an effective workout at home. A few plates, and you're good to go. I don't even need a gym. All I need is some space and my plate, and I'm doing good. Go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Drop it, shake it off, set up. You can stretch it out if you want to. What we're going to do now is we're going to transition. I want you to get your intermediate level weight plate. For me, that's a 25-pound plate. It's going to go back on our back again. That plate's going to go above our head. What we're going to do is we're just going to do a pullover. So our feet go flat. I'm just going to pull it over and then back down. It's good for our back, our abdominals. Chest is a great exercise. See a lot of guys do this in the gym. Again, we don't need a bench. I don't need a gym. All I need is some space and a plate, and I'm getting a great workout. And again, you're using that intermediate weight. It's great for body workout. Come on, go 5, 4, 3, 2, 1. Set up, drop it, grab those 10-pound plates again, and we're going to do some chest flies. So we're going to roll back on our back, just take them out, and bring them in. Now, if you can do these flies with the 25-pound plates, 35-pound plates, if you're a monster, you can do that. I don't have any monsters in here with me. We're just airmen. We're not that tough. You Marines out there watching, maybe that's what you can do. It's going to get these flies in. Make sure those shoulders are nice and retracted back there. This weight opposes your chest muscle, and bring it right up to the middle. Go 8, 7, 6, 5, 4, 3, 2, 1. Relax. Set up. Stretch it out. How we doing at home? I hope you're doing good. Guys, we doing okay back here? Feels good? So far, so good? All right, let's move on. Everybody, up. Now we're going to work a little bit of shoulder work. Intermediate level plate. For some of you, it may be your lightest plate. Shoulder muscles aren't real strong, but what we're going to do is we're going to take this plate, we're going to bring it straight up in front of us. Just like that, you bring it up to eye level. I'm going to check their form on this one. So I see it done wrong a lot of times. Great form here, focusing on the anterior deltoid. This is great for helping with that push-up test. Anterior deltoids are engaged a lot. Feels good. If you need to go to the 10-pound plate, go to the 10-pound plate. We're going to do about 5, maybe 8 more of these. You keep going at home. We'll see you after the break. All right, welcome back from the break. We're stretching out after doing our frontal raises with our weight plates. We're going to continue on with our full body plate workout. We're going to grab our low weight plates here. You got a 5-pound plate at home, 10-pound plate is what we're going to use here. And we're just going to do some lateral raises for our deltoids. Now, I see this done in the gym a lot of times. Guys will have their elbows at a 90-degree angle doing that. Really, to get the best workout for your shoulders here, your arms should be as straight as possible with a slight bend in that elbow. I want to check their form. Listen to my visual cues at home because this is key. I see this weightlifting technique done wrong a lot of times in the gym. We got a great workout here. She's coming up to her side. Great. All the focus is on this medial deltoid. Notice how her arms are straight, just like I cued a minute ago. Elbows are slightly bent. You guys only do about 5, 4, 3, 2, 1, relax. Now, I want you to grab your intermediate weight plate or your heavy weight plate. We're gonna do some military presses. We're gonna take that plate, put it above our head, and we're just doing some military presses. Careful, don't hit yourself in the head. Again, I see this done wrong a lot. I'm gonna go back and talk to you about the form on this. Listen to my verbal cues. See guys doing this a lot with a bar. They're raising that neck forward, and that compromises the integrity of that spine. You don't ever want to do that because that really is harmful. This is a great way to do these and use good, simple form. Jim here, smiling the whole time. You feel that right there where you should. Great military press here, and the form is always correct because you can't go down behind that neck. Let's go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Drop it, shake it off. I know your shoulders are burning. They burning, guys? Yeah, that's a good shoulder workout right there. Again, using these weight plates, it almost forces you to have good form on this. All right, let's move from our shoulders to our biceps. So again, grab that heavy plate, intermediate plate, the heaviest plate that you can to do these. We're using the plates with the grips, but you don't need them. And we're just doing bicep curls. Set it once, set it twice. I'm gonna say it again. You guys don't need a whole rack of dumbbells. You don't need a bar. You just need a plate. And you get a great full body workout. I'm gonna check their form here. And guys, Air Force people are so convinced they have to be in a gym to get a good workout. I can do this anywhere. If I've got these plates, I can go right outside in my yard and do them. No need to be at that gym. Good form, elbows are locked to the side. These biceps are really pumping. Get that great form, feeling good? Doing good so far. She's got a little lower weight plate here. Just fine. Keep those elbows only. I'm key with that form. Let's go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Drop it, shake it off. You can stretch it out a little bit if you need to. We're gonna go into a tricep. You can grab that intermediate plate, heavy plate, however you wanna do it. This, I'm gonna show you. Turn to the side here. Elbows, that head still stays up. Elbows are in, tight as they can be. and I'm just lifting it up. Now, if you're really strong and you want to use single arm, that's fine. I wouldn't suggest that. And again, the size of this plate almost forces your elbows to stay at the perfect angle. I'm going to check their form here, because what you don't want to have is those elbows flying out. That compromises the integrity of the exercise. Good form here. It's all on his triceps. How's that feel, Jim? Feels good. You doing good? Keep going at home. Great workout here. Let's go. 8, 7, 6, 5, 4, 3, 2, 1. Drop that plate, shake it off. Grab those light plates again if it's a 5 pound, if it's a 10 pound. Here's what we want to do. Reverse grip, curl ups. Again, biceps and forearms. Hitting that bicep, I'm going to check the form. You listen to my verbal cues at home. She's using 1 plate, you can go to 2. Little difference is forearms are more involved. And again, that biceps is a 2-headed muscle. She's hitting it at a different angle, forcing the fibers in that muscle to be recruited from a different area, thus making the entire muscle stronger. It's always good to keep the shot going in that muscle. The more you keep that muscle guessing, the stronger it's going to get. Your body doesn't like to be outsmarted. You keep trying to outsmart it, and you're going to get stronger. Let's go. 5, 4, 3, 2, 1. Now, I said earlier, if you're strong enough and want to get those big plates for the single arm raises for the dumbbells, we're just going to take our 10-pound plates, go right over. Very easy to do here. I see this done wrong a lot of times. Keep that elbow forward. Don't go below 90 degrees. I'm going to check their form again. You listen for my verbal cues at home. Get Jim here. Perfect. Elbow stays towards the front of his body. That head and neck neutral. Roll it back just a little bit so you don't knock yourself in the head. And there you go. That's what it should look like. Feel the difference there, Jim? All right, that's what it should look like. Let's go. 5, 4, 3, 2, 1. Switch sides. Now, if you've noticed in this workout, we've hit opposing muscle groups. That's the way you should work out. If you work the front, you work the back. If you work the left, you work the right. If you work the top, you work the bottom. Gives you good balance and symmetry. And plus, when one muscle is working, the other one isn't. It's the agonist and the antagonist, so they both need equal work. So one doesn't overpower the other and cause injury. Let's go. 5, 4, 3, 2, 1. Relax. Let's get on that mat now and do some abdominal work with our plates. I want you to grab that intermediate weight plate. For me, that's going to be the 25-pounder. I'm going to put it right across my chest. I'm going to hold it, and I'm just going to do a curl up. Not a big range of motion here, but that weight is providing resistance. You roll that rib cage towards the hip and really use this weight to strengthen those abdominals. Let's go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Now, take that plate above your head. And what I want you to do is I want you to bring it up with your legs. Feet in the middle. We're going to do about 10 of these. 3, 4, 5, 6, 7, 8, 9, 10. Relax. Catch your breath. Let's do 10 more. Let's go. 1, 2, 3, 4, 5. While we finished up this set of 10, you keep going at home. We'll see you after the break. 8, 9, 10. Relax.
Hello, I'm Commander Dave Keblish, orthopedic surgeon and team physician at the U.S. Naval Academy. You've heard me say before that cortisone is a good type of steroid that our bodies produce naturally to help reduce inflammation. Cortisone is available in over-the-counter preparations, and doctors prescribe it in many forms, such as creams, inhalers, pills, and shots, for a variety of diagnoses. I use cortisone shots in the management of sports injuries all the time. Most patients, however, have a similar response whenever I mention the possibility of a cortisone shot. They'll say something like, "I don't know, doc. I've heard that cortisone doesn't cure anything, it only masks the pain." Cortisone shots can play an important role in the treatment of certain inflammatory conditions involving joints, bursa sacs, or tendon sheaths. Joints are lined by synovial cells that secrete lubrication fluid. This synovial lining is sensitive tissue with a very rich blood supply and lots of nerve endings. I tell my patients that when this tissue becomes irritated for any reason, say a sprain or some torn cartilage or overuse, the synovial lining reacts the only way it knows how, by becoming thickened and over-secreting fluid. When this happens, the joint becomes swollen, stiff, and painful. Sometimes cortisone shots work like magic, reducing the inflamed synovial tissue called synovitis. And this reduces pain and swelling and improves range of motion. It can really jumpstart the rehab process. It is true that cortisone does not cure the underlying problem that led to the inflammation in the first place. However, it can help restore the patient's quality of life and get him back on track while he seeks a more long-term solution, perhaps through therapy, weight loss, a brace, or even surgery. To help my patients understand the benefits that a cortisone shot can have in treating a painful joint, I use the example of nose sprays, like Afrin or Neosynephrine. These nose sprays are not steroids, but they also work by shrinking inflamed and swollen mucous membrane tissues, which are similar in some ways to synovial linings. Just like cortisone, Afrin does not cure the problem. It doesn't reduce the pollen in the air or eradicate the sinus infection that was leading to the nasal stuffiness. But by reducing some of the secondary symptoms, it can dramatically improve the patient's quality of life in the short term. So if your orthopedic doctor suggests a cortisone shot, let's say for some bursitis you may have in your shoulder, think of it as a little puff of medicine to reduce inflamed synovial tissues. Just like Afrin nose spray, cortisone alone is never enough. For a real cure, some other treatment modality or activity modification will be needed. So if your doctor suggests cortisone shots, they might work wonderfully in the short term and help jumpstart your rehab. Don't be afraid of them. Together, let's train smart and stay strong.
Welcome back to Fit for Duty. I'd like to thank the Thunderbirds, Nellis Air Force Base Fitness Center, my fitness team, Becca, Jim, and Amy. Thank you at home, and be sure to join us next time as we get you Fit for Duty!